Hi, student Dr. Spears here with drpremed.com, and I want to talk to everyone about the subject of medicine, why we study, why we put in all the long hours, what it really means, and why you really need to go above and beyond what even you think is necessary. Medicine's not a joke. Medicine really does mean a difference between whether somebody lives or whether they die, and that's based on what type of knowledge you possess or do not possess. As one of my professors said in medical school, you can't prescribe what you don't know. You can't treat what you don't know. If there's something that you never heard of, never understood completely, how can you intervene on a patient's behalf and fix that problem or medical issue for them? It's impossible. You're not going to be able to do it. If you didn't memorize your pharmacology and know what type of drugs to administer for a patient, then that's the last stop, because whatever you do is not going to be meaningful and it's not going to be helpful for them. And the reason I'm sharing some of this is to give you guys a little bit of a glimpse into the life of a medical student and what you should expect down the road, and even not even just as a medical student but in your future career. There's going to be a lot of demands placed on your time. There's going to be a lot of things that you're going to think is silly, isn't warranted, or why am I learning this? And you're going to take your board exams, and oftentimes they're going to ask you nitty gritty things that maybe in medical school they kind of just glossed over and weren't so focused on, but then you find out that's what a lot of your board questions actually are on. So you just need to know things. You need to really tell yourself, learn to learn and not learn to pass a test or an exam, because I can't tell you how many times that I've been in the hospital, in clinic, or in the OR, or anything like that, and working with a patient, working with the other doctors and medical staff, and it's something that you think like, oh, this was first year of med school, or oh, this was second year of med school, and now I need to know everything about it, and you don't have time to look it up in a book. Nope. And you think, oh, well, whatever, no books, I'll just use my cell phone. Nope. You're not going to have time to pull out a cell phone in certain situations. And even if you're like the ED or the operating room, definitely not going to be able to reach out for a cell phone to look something up. You have to know it. And if you don't, you just got to go with that knowledge that was ingrained in your head as a medical student, a medical professional. But what I want to get at is what happened. We had a patient. The patient wasn't looking too well, and the doctor looked at me and asked, Jason, what do you think we should do with this patient? And I could tell that they were sincerely asking for not just they already knew, but let's get two heads thinking about this. And when you wear a white coat and you have that stethoscope, people are going to respect you for the position you're in, even if you're not already a graduated physician. It's because you've been in medical school, you've been in the trenches, you've done rotations, and so your opinion is going to be valuable. And I said, based on the presentation of the patient and some of the signs and symptoms that were being exhibited in the past medical history, the comorbidities that the patient had, I think that they needed to go to the hospital. And then that was that. We sent the patient off to the hospital. That's great. And then one thing I learned is always check in on any patient that you ever laid your hands on, put a scalpel on, or just were there for them. It is your duty to reach out and see how that patient's doing, especially when you're in a hospital and patients are admitted to your hospital. Take the time to go up the steps, go on the floors, and visit the patient, check in, see how they're doing. That's going to mean the world to the patient and their family and friends. So if you can do that, definitely do that. And don't just be like, oh, I treated, I did my part, and then don't even follow up with patients. And today was very interesting because I usually always ask about like, oh, how the patient's doing, and we found out the one that we sent to the hospital, he almost died. he really almost died. And that hit home because a lot of times people go to the doctor and they think, oh, routine visit, gonna get in, get out, and that's not the case. There's so many people who, in a split second, their world is turned upside down. Another case, we have a patient came into the doctor today, and their life is never going to be the same because they had a diagnosis that's not curable, not treatable, and they're just going to have to live with what they need to do to keep themselves healthy, and that's what happens in medicine. And so you guys got to really understand what's at stake and what's really on the line. Like, it's not like, oh, you just got to memorize and learn to pass a test, show your attendings that you know things. It's because patients are really going to be dependent on you. And so going back to the story, we found out that the patient that we sent to the hospital had been there for a couple of days and actually was transferred to a more acute care hospital that had a lot more specialists, big Neem hospital in Manhattan, to take care of this patient. And what was crazy is some of the other staff at the clinic and at the hospital said, who was the physician who made the diagnosis? That person is a stud. They're a rock star. They are on top of their game and they saved this guy's life. Somebody at the hospital knew what was in the books. They saw the patient. They saw the medications that the patient was on. And despite everybody else thinking, oh, they're already taken care of, their INR levels normal, and some other factors, there's nothing else to do for the patient, this doctor said, no, something doesn't seem right, and took another imaging test, did some other exams, and changed that patient's life where that patient's going to live because of what that doctor did. Do you think that was somebody who just crammed at the last minute for their tests and exams, who was just like, oh, I'm just doing enough to get by? You can bet your tail that was not the case. This was somebody who was totally dedicated and motivated to being a doctor and put personal feelings aside, personal issues aside, and was in there working for this patient to make sure that they had the best outcome possible. And that's what you guys need as a pre-med student or a medical student or a resident or a physician, whatever's going on, wherever you're at. Don't take things for granted. Don't just think it's routine. Don't just think, oh, I've seen this a million times, I'm going to just run through things. Investigate if something looks different. If something's abnormal, ask yourself why. What could this mean? Challenge yourself to be better. Challenge yourself to do more for your patients. Challenge yourself to be the best doctor, where that doctor probably isn't going to get any accolades or awards and has no clue that there's other physicians who looked at that chart, knows that patient, and we're giving that doctor high fives, giving him the highest accolades, and just thinking the world of that doctor because he did something that most other physicians won't do, and he's probably not getting recognized for it, but he saved somebody's life. He literally saved somebody's life that everybody else was missing, overlooking, or didn't even think of. But this doctor saved somebody's life. Who knows if they're the smartest person in the room? Who knows what type of board scores they got, what they did on the MCAT, what their bedside manner is. But they obviously did something right because somebody's going to live because of what this doctor did. And that's the approach you need to take with your academics and everything related to being pre-med, getting into medical school. Are you pushing yourself? Are you truly investing in the material? Are you invested in doing everything you can to be the best doctor, to be very knowledgeable, to keep up to date on current trends in medicine? Because it's not about you. It's about that patient. It's about their family. Because in a split second, everything can change. And you need to be the one who's going to be the one who they come to and can help them and lead them to health, success, and just being able to lead the most normal life possible because you were a great physician And so this is Jace with drpremed.com, just giving you a little bit of motivation from today and just some of the experiences I had recently, and just wanted to share that with you guys so you have a taste or an understanding of what goes on in medicine and why you really need to study, why you need to put in the time and effort, and why you need to keep motivated, because people depend on you, lives depend on you. It's based on what you know and don't know. It makes a difference between whether somebody lives or doesn't live. And so this is Jason with drpremed.com. Thanks.